Hello, this is Dr. Hall. We're going to talk about pronation distortion syndrome, also known PDS for sure. And this is a postural distortion pattern and characterized by foot pronation and lower extremity muscle imbalance. And in here we have the definition. We have this definition of the book National Academy of Sport Medicine, Essential of Corrective Exercise Training, page 122. You can read it over there, but learn about PDS as a postural distortion pattern. We are going to use this terminology of this book. Basically, it's excessive foot pronation, like a flat foot and knee valgus, inward knee collapse. This leads to muscles imbalance, and compensatory movements pattern can increase the risk of injuries. And more about this pronation distortion syndrome, is abbreviated as a PDS. Is a term used in corrective exercise to describe common lower extremity movement dysfunction characterized by excessive foot pronation and flat feet and knee valgus or no knees. And this misalignment can lead to altered joint mechanics, muscle imbalance, and increase the risk of injury. And pronation distortion syndrome is part of one of the Yanda's three postural distortion syndromes: the upper cross syndrome, the UCS, the lower cross syndrome, and LCS. And this the PDS is because Dr. Vladimir Yanda, renowned neurologist and physiotherapist from Czechoslovakia, identified the three primary postural distortion syndromes based on patterns of muscle imbalance and their effect on movement and posture. And this syndrome describes how certain muscles become tight or overreactive while others become weak or underreacted, leading to poor posture or dysfunctional movement and increased injury risk. And we're going to go to more information about this with the key characteristics of pronation distortion syndrome, the PDS. And we can observe over there four main: the overpronation of the foot. This is like excessive inward rolling the foot arc. And the next one is the knee valgus or knock knees. The knees collapse inward. Basically, this is the characteristics. And tibial and femoral internal rotation. That's like a chin and thigh rotate inward. And pelvic instability often is an anterior pelvic tilt than happen in this condition. We have again over there in the screen the definition of the book, and we have a picture that describe with an arrows the key characteristics of pronation distortion syndrome. And the common causes of PDS, we can mention four, like poor movements mechanics, for example, improper squatting exercise, or improper walking, or improper running can lead to PDS. And other ones can be weak stability muscles in foot, ankle, hips, and core. And other one could be the overuse compensatory movements pattern. And other one than we can find is prolonged wear or of improper footwear. So we have these four in this condition of PDS. And in here we can observe the muscle imbalance in PDF. We have many muscles like are overreactive. We have over there 6 examples, and we have 4 examples of weak underreactive muscles. We're going to check it one by one in the next slide, and we're going to use both books, the National Academy of Sport Medicine, the Corrective Exercise Training, and we are going to use also the Functional Anatomy by Kyle with different perspective. So we're going to start with number 1, the tight overreactive muscles. We have the soleus and gastrocnemius. That's involved the muscles of calves, and we have again other muscles in the leg. The peroneals lateral is the lower leg, and other muscles that are involved are the abductors. And another region of the leg, the lateral leg, is the iliotibial band, also known as IT. So we have this part as muscles that are overreactive or tight. Other muscles that have these same characteristics is going to be the biceps femoris and the iliopsoas and rectus femoris. Then basically these muscles are the hip flexors, and in case of a biceps femoris, is going to be more the short head and lateral hamstring then is going to be involved in this. In a different perspective, we can identify how with the pictures of the Functional Anatomy by Kyle and Christie, we can palpate in a correct manner these muscles. Remember, tight overreactive muscles are going to be gastrocnemius, soleus, peroneals, abductors, and iliotibial bands. And we have also the muscles like the rectus femoris, iliopsoas, and biceps femoris that are tight and overreactive muscles for these conditions. Now we go for the other side, that are muscles weak, underreactive, and we're going to start with the tibialis anterior and posterior, and the gluteus. We have both of them, two of them, the gluteus maximus and the gluteus medius, the posterior and anterior fibers. And we have another group of muscles, and then are the hip external rotators that are many, the piriformes, the superior gemellus, internal obturadors, inferior gemellus, and an external obturator. In general, these are the hip external rotators as a group, and we have another one that is the vastus medialis, that is pointed with an arrow. In a different perspective, in here we can observe it with the books Functional Anatomy, the gluteus maximus and gluteus medius and vastus medialis, how we can identify it in superficially and to palpate. And in here we can observe the muscles related to the leg, the anterior tibialis, posterior tibialis, and hip external rotators. More information, important information about this pronation distortion syndrome, the PDS, or the injuries involved and potential issues. We can observe the table 5.4 of our books, and here we can focus in the last part of the table, the possible injuries. we have plantar fasciitis as a possibility of injury, shin splits. We have patellofemoral pain syndrome, runner's knee, anterior knee pain, iliotibial band syndrome, and lower back pain. There are the more characteristics of this condition and disorder. And now we're going to go for the National Academy of Sport Medicine corrective exercise strategies for pronation distortion syndrome. And we're going to have here and analyze in here the continuum of exercise to address muscle imbalance and improve movement patterns. So we can observe over there for corrective exercise strategies. Number one is inhibit, release overreactive muscles. Number two is leg, stretch thigh muscles. Number four, activate strength weak muscles. And finally, the number four is integrate, improve movements patterns. So let's explain one by one an example of this a continuum, and we can observe over there the National Academy Sport Medicine corrective exercise strategy, starting with inhibit release overreactive muscles using foam rolling, and use self-myofascial release techniques is beneficial to reduce tension and overreactive muscles, like as you can see on the picture, the gastrocnemius and soleus. You can do foam roller for 30 to 60 seconds each. The same way the lateral lower leg that correspond to peroneal muscles, the abductor, inner thigh, also a foam roller 30 to 60 seconds, and we can do also foam roller 30 to 60 seconds for a lateral hip and thigh, the iliotibial band, and finally we can do the psoas and the rectus femoris, as you can observe on the picture, for hip flexor foam roll 30 to 60 seconds. This we can observe in here also that the foam roller we're going to talk about later in the course, but it's beneficial. The benefit of using foam rollers includes it's easy to use and the ability to provide acute response for improving muscle length and joint motion. And if you have the opportunity to use with yourself, a foam roll is going to be good to understand the technique with us, because you can apply later with patients or clients with this condition. And using a foam roller for myofascial release can reduce muscle tension, which can help length muscles, but this is a short-term change in architecture of that muscle tissue. So, but it's going to be beneficial for the next step, and we can observe in here basically is stretch thigh muscles, and lengthen is the second step recommended by the National Academy of Sport Medicine. And we have two types of stretching: static stretch, but basically is the stretch is held the first point of tension or resistant barrier for 30 seconds, and the other one is assisted stretching, and in here is recommended the PNF is commonly stretch assisted, called proprioceptive neuromuscular facilitation, or PNF. And we have more information in here of your book about stretch. You can hold 20 to 30 seconds the different area, like calf stretch, abductor stretch, hip flexor stretch, and the iliotibial band stretch. And now we'll go for the number 3, Number 3 is activate, is strength on the reactive muscles. And for here, we can observe that we can use many exercises, but focus on strengthening weak muscles and improve stabilization and movement control. So we have over there the tibial postural activation. You can do resistance band, dorsiflexion and inversion, 3 or 2 sets, 15 reps. We can observe over there the glute bridge is glute activation, 2 to 3 sets, 5 repetitions can be a possibility. Lateral band walks is another. You're going to activate the gluteal medius, and the same 2 or 3 sets, 10 repetition per side. It's a good option. And the single legs balance exercise. This is for proprioception using different materials and foot. You go for foot stability. You can do 3 sets, 20 seconds per leg. And finally, we had the number 4, where you are going to integrate to improve functional movements pattern for pronation distortion syndrome. You're going to reinforce the proper movements mechanisms with functional exercise. We have some examples in here. Squats with proper form, that's focus on knee alignments and gluteal activation is in here the important, and setups with controlled descents. The strength glutes and quads is going to be important in here. And single leg Romanian deadlifts is a good exercise that we can use for this condition. With this, we're going to improve the stability and posterior chain strength. And now we have the walking lunges with bands. In here, we are going to encourage proper knee and foot alignments. Well, as you can see, we we analyze, summarize, or break down this corrective exercise continue, summarizing the National Academy of Sport Medicine approach with release overreactive muscles, with in-body techniques, stretching thigh muscles, like the soleus and gastrocnemius abductors and flexors, and strength weak muscles like gluteus or tibialis posteriors, and integrate those movements patterns with exercise like squats or lunges. Well, this was pronation distortion syndrome.